www.healthcmi.com. Acupuncture continuing education online today. Acupuncture provides Parkinson's disease relief. This research was published at Health CMI July 7, 2018. The essence of the research, both from Zhejiang University of Traditional Chinese Medicine and also from the University of Arizona, from the surgery and neurology departments, is that acupuncture helps patients with Parkinson's in terms of tremors, gait, and balance. This is something that is enormously important because it is difficult to make any progress with Parkinson's disease. In the first study, it shows that acupuncture is a great adjunct to drug therapy. So the drug therapy had a 52.6% total effective rate, but adding acupuncture to that drug therapy protocol increased the efficacy to 89.4%. It's a huge gain, and that means a lot to Parkinson's disease patients who would like a moment of peace when at rest, but also would like to be able to walk better, be able to function better, be able to hold a teacup in a better way. The reality of treating Parkinson's disease is this. There is no known truly satisfactory cure that can be applied across all patients. There are many experimental procedures, including surgical procedures, drugs, and acupuncture. Now, acupuncture has a few benefits. One, it is essentially without adverse effects. Yes, someone can get a bruise, but in most situations, there's no risk to the patient, certainly relative to the medications, which can have significant adverse effects. In fact, one of the things that the researchers found was that acupuncture reduces the side effects associated with Parkinson's disease drugs. Another problem that patients can get into with Parkinson's disease drugs is that they actually cause problems in and of themselves that can make the condition worse long-term. Although providing short-term relief, some of the drugs can very much get patients into serious trouble later on. But Parkinson's ultimately is not something that is satisfactorily met with any medicine, in that there is no cure across all patients. There are patients who go into a relative remission or that doesn't get worse as badly, and I'll explain that in a little bit. Speaking for acupuncture and the research here at healthcmi.com, you would simply go to healthcmi.com, click on News, and look for the article entitled Acupuncture Provides Parkinson's Disease Relief, published July 7th, 2018. So, speaking for this research and what one would normally see in an acupuncture clinic, and this research is a sham-controlled clinical trial, patients can expect to maybe hold the line or have modest improvements. And for a Parkinson's disease patient, that is quite a lot. Naturally, the earlier someone comes in the stage of this illness, the better. Why? Once the patients begin to slip, it is hard to regain ground. So the goal of the acupuncturist is to hold on to the health that that patient has as long as humanly possible. It's very difficult when patients have a long period of not eating well or not sleeping well, or if they have a sudden injury or emotional shock or trauma. These type of things tend to spiral out of control for Parkinson's disease patients, and they have a downward trend which may not recover. Now, one good thing about acupuncture is if some type of shock on the system is acutely presented to a Parkinson's disease patient, let's say something emotional or let's say a broken ankle, whatever it is, an enhanced protocol of acupuncture treatments, in other words, several treatments a week for a few weeks, may prevent the patient from backsliding and hold the line right there, or at least reduce the amount of issues that come up. So the goal with a Parkinson's disease patient for an acupuncturist is to make progress and to move forward and keep the baseline at least steady and inch forward towards a much healthier life. setting goals like being able to eat, let's say, or be able to drive, or what have you, improving the gait, range of motion, stride length. Take a look at this article. It goes into details. But again, the overall picture is that Parkinson's disease patients will need ongoing care. This is not something like shoulder pain where an acupuncturist can have you in and out relatively quickly for many, many types of shoulder pain or back pain, what have you. Even migraines can be cured, even if they were lifelong migraines. Parkinson's disease is another situation where there's a dopamine problem in the brain. And right now where science is, right now where surgery is, right now where drugs are, acupuncture is an important treatment protocol for patients with Parkinson's disease to significantly improve the quality of life. Now, whether it's strong or light acupuncture is another story. Sometimes the acupuncture must be very gentle for these patients, and they respond incredibly well to very thin, very light needling, very thin needles, very modest. A more robust acupuncture treatment might be appropriate for, let's say, an athlete who injures something. But in this case, sometimes what we say the chi in blood or the energy level is so low that a more gentle approach is not only appropriate but more effective. Take a look at this research. The acupuncture points presented really interesting stuff. And of course, they recommend scalp acupuncture. I think you'll like it. But more importantly, regular care to Parkinson's disease patients is ultimately very important to provide a happier, healthier life. Thank you for listening. For healthcmi.com and its authors and presenters, thank you. www.healthcmi.com.